um, and also we will guide you, and we will discuss with you about your answers, so we can give you some tips and tricks about how to solve any task in this module. This is the idea behind our free webinars, our coming free webinars, and we will start soon. So I want one of you to start reading for this task. Who will do this task? Hello. Hina, Alak, Mara. Okay, Malak. You have 2 minutes for reading, starting from now. Okay, shall we start?
Yes.
Okay, please
Can you
start.
hear me? Yeah. Hello, I am Dr. Malak, one of the doctors in the early pregnancy unit. Can I confirm your name and age, please?
My name is Jennifer Stone, and I'm 22 years old.
Okay, can I call you Jennifer?
Yes, doctor.
Okay. So Jennifer, I understand that you're here today because you have a positive pregnancy test with some vaginal bleeding. Am I correct?
Yes, doctor.
Okay, so in order for me to help you throughout this consultation, I need to ask you a couple of questions. Would that be okay with you?
Yes, it's okay.
Okay. Can you tell me more about this bleeding that you're having?
Yes, doctor, I have just spotting from yesterday.
Mm-hmm. Okay. Is it the amount, is it large or a small amount?
No spotting, just spotting, small amount.
Okay. Do you have any pain associated with this bleeding?
No,
No pain. Okay. Do you have any shoulder tip pain?
no,
Any dizziness or fainting?
no,
Have you had any have you had any abnormal discharge during this pregnancy?
no, doctor.
Okay. And is this pregnancy a planned one?
No, it isn't a planned one. I
Okay.
am very busy, and I am very busy, and but I'm okay with this pregnancy. I want to continue the pregnancy.
Okay, I understand that, and I want to congratulate you on this pregnancy. Okay, and now can you tell me if you are taking any folic acid?
No, I didn't start it yet.
Okay, so I need to prescribe you folic acid supplementations because it helps in the development of the fetus. Would that be okay with you?
Yes.
Okay, good. Can you tell me more about your periods? When was the last period you had?
I think 5 weeks ago.
Okay, and is it regular usually?
Yes.
Have you had, sorry to ask, have you had any sexually shared infections in the past?
No, no.
Nothing, okay. Have you had your pap smear done?
No, doctor. I don't have. They
You
don't call
don't have
me
it.
yet. Yes.
Okay, you're 22 years yet. Okay. And is it your first pregnancy?
This is my first one.
Okay. Are you in a regular relationship?
Yes, with my partner, with a new partner.
Okay. And is your partner supportive?
Yes.
Okay, that's good. And do you have any medical conditions that you visit the GP for?
No,
Any surgeries in the past?
no,
Any medications on regular basis?
no.
Okay, and pardon me to ask some private questions.
It's okay.
Do you okay, do you smoke?
No, doctor.
Do you drink alcohol?
No,
Any recreational drugs?
no.
Do you happen to know your BMI?
Yes, 22.
22, okay. And do you know your blood group?
No, I don't know.
Okay, so we'll do that test for you if that's possible. And do you have any objections to blood transfusion if that's needed?
No, doctor.
Okay. And how have you been feeling in the last couple of weeks since you found out that you were pregnant?
I am okay.
Okay, that's good to hear. So, Jennifer, I have your blood tests and ultrasound results with me. And after confirming your name and age on these tests, I will tell you the results of the tests. Your hemoglobin, which is the oxygen carrying capacity in your blood, is within the normal range, so that's good. Your pregnancy hormone is elevated, which means that it confirms that you are pregnant. But it's still lower than the range that we can see a pregnancy inside the womb. Okay, and that is confirmed by the ultrasound scan. So the ultrasound scan does not show any pregnancy inside your womb, but this is because it can be very small at this moment, and your pregnancy hormone is very low. So we have a couple of options for you to do after this. Would you like to hear them?
Doctor,
Yeah.
am I pregnant? My pregnancy is
Yeah.
okay or not? I
Yes, you
didn't
are.
understand you.
You are pregnant because your pregnancy hormone levels are high, okay, but they're a little bit lower than the cutoff point that we can see a pregnancy in the ultrasound. Is that do you get me?
Yes.
Okay, so the ultrasound scan does not show any pregnancy yet, but it's there. We cannot see it because it's early in pregnancy. Okay.
Okay.
Okay. Now, the thing that we are going to do is we will repeat your hormone pregnancy levels after 48 hours and carry on from that point. Okay.
Okay.
Okay. Now, it can be elevated more than the levels that we wish, which is indicative of a normal pregnancy. In that case, we will repeat the ultrasound scan after 7 to 10 days to locate the pregnancy. Okay.
Okay.
And it can be after 48 hours, it decreases to the levels that we know, which means that it can be a failing pregnancy. Okay.
Okay.
In that case, we will repeat the urine pregnancy test after 2 to 3 weeks to confirm that it has gone. Okay.
Doctor, as I said to you, I am very busy. Why you didn't give me any pills to get rid of this pregnancy?
Well, if I understand your concerns and you're busy, you and your partner, and if you wish to terminate this pregnancy, we will support you with your decision. But at this moment, we do not know if the pregnancy is going to be viable later on or if it's going to be failing on its own. So first of all, we need to confirm that it's a pregnancy that is inside the womb or outside the womb before we can give you any pills to terminate it. But when we locate the pregnancy, within the next 48 hours. If you choose to terminate this pregnancy, we will support you with your decision and refer you to the termination clinic. Okay?
Okay, doctor.
Okay. So the last case that would happen is if the beta or the hormone pregnancy levels are not within the range that we wish. This could be a pregnancy outside of the uterus, outside of the womb. Okay. And this is called an ectopic pregnancy, and it can be, if maintained, a life-threatening condition. So we need to manage this at once. Okay, if this happens in 48 hours. Okay.
Okay, doctor, you know, I know one of my friends, they have this problem and they give her injection and everything was okay after this injection. Why you didn't give me this injection?
Your friend had a pregnancy outside of the womb?
I didn't remember. She told me that she just took an injection and everything was okay after that.
Yes, as I said before, we cannot give you any treatment to terminate the pregnancy unless we locate where it is. Is it inside the womb or outside the womb? Because each case has its own management. So we need to locate the pregnancy first, and then we will give you the options of terminating this pregnancy, and we will support you until it's terminated and you get recovered well. Okay?
Okay.
Okay, so now I will give you a patient information leaflet to read about everything I told you. And the plan is to repeat the hormone pregnancy level within 48 hours. And I will give you contact numbers to call if you have any severe bleeding or if you have any severe pain or shoulder tip pain. You should call us back and come back to the early pregnancy unit for further assessment. Okay?
Okay.
And I will book you an appointment with my consultant to
Is it safe
discuss
to
the
is it
options.
safe to go home, doctor?
At this moment, we can give you some a contact number to call if you want to go home, and if you have any bleeding or pain, severe bleeding or severe pain, you can call us. But at this moment, you can go home.
Okay, doctor, thank you.
You're welcome.
Thank you, doctor. Perfect.
You. Thank you.
I think you are perfect. You have the knowledge, you have some communication skills,
Thank
but
you.
we want just some modification. I
Okay.
will go through the whole task and we will discuss about your performance, and also we will give you some tips and tricks how to um, get the maximum marks of this task.
Okay. That
Uh,
would be great. Thank
your introduction was very good, very good.
you.
And then you started your history taking by an open question about the bleeding, which is perfect. Also, you try to analyze the current complaint, which is also perfect, and then you go through the signs and symptoms of urgency and emergency when you asked here about shoulder tip pain, fainting, which is also perfect. And this is the
Mhm.
logical way to take a history in the exam and also in your life. Please
Yes.
try to ask an open question at the beginning of the discussion and then analyze this complaint, like the onset, course duration, what increase it, what decrease it, how this affect your daily activity, and then go ask her directly about any signs or symptoms of emergency.
Okay.
Also, You asked here about if this is the first pregnancy and if it is planned or no, if she's happy with this pregnancy or not. But please don't congratulate any patient about anything
Okay.
because you told her, I want to
Yeah, she wants
congratulate
termination.
you, but it is a pregnancy of unknown location right now. It isn't a healthy pregnancy right now. So
Yeah.
okay, so you congratulate your patient about an unhealthy pregnancy. So try, don't congratulate any patient in the exam.
Okay.
Okay, about smear. It is an irrelevant question and it
Yeah,
take
yeah.
time.
After I remembered that she's 22.
Okay. After
Yeah.
that, you asked about the risk factor, which is very important also here. I want to tell you that relevant question which answer directly affects your management.
Mm-hmm.
So try to choose a relevant question in history taking because you spend about 4 minutes and half in history taking.
Okay.
Don't say I will ask you some personal or intimate question before smoking or alcohol
Okay.
because the RCOG itself in her
Mm-hmm.
courses uh, distress or stress on this question, on this sentence. Don't say I will ask
Okay.
you a personal question. It is a daily activity there, so it is okay. Do you smoke? Do you drink alcohol? But no, before recreational drug, say sorry. Okay.
Okay. So only
Psychological.
recreational drugs I should
Yes, only,
signpost.
only. Yes, only.
Okay.
Okay. Don't
Okay.
signpost before smoking or alcohol.
Okay.
Okay, this cases of uncertainty or cases of negotiation usually have a lay examiner.
Mm-hmm.
So lay examiner instructed about something like this.
Okay.
Okay, about psychological history, I think it is not relevant.
Mm-hmm.
You didn't examine your patient. You should to examine here.
Oh,
Take
yes, that's
swabs.
true.
Okay. And when you started to tell her about the results, you started with the normal things and you go, but you didn't tell her directly the diagnosis. You should to tell her that we have a pregnancy of unknown location. And in exam, please try to use your pencil and your paper and to draw to her about the normal pregnancy will be here inside the womb. Sometimes we have pregnancy outside the womb, but now we don't see any pregnancy here or here. So it is a case of a pregnancy of unknown location.
Okay.
We have probabilities of, or three options or three
Mm-hmm.
scenarios, and you will go for the three scenario. We will repeat after 48, and if it is rise significantly, so it is a healthy pregnancy and will continue. If it is decrease significantly, if it is it will be like unhealthy pregnancy or missed pregnancy, missed abortion, missed miscarriage, and if it is stable, we will repeat the ultrasound to trying to locate the pregnancy.
Okay.
So tell her directly the diagnosis, pregnancy of unknown location. Okay.
Yes. Okay.
Just I want to tell you about some things in communication. Don't say to
Yeah.
your patient in the exam, "Do you get me? Did you
Mm-hmm.
understand?" No, 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 no.
Okay.
Just am I clear?
Okay.
Because if
Okay.
you tell her, "Do you get me? Did you understand?" It is like a judgmental words.
Mm-hmm.
Okay.
Okay.
Also, you said, as I said before,
Mm-hmm. Okay.
it
It,
is
it
also
looks like she didn't understand. Okay.
yes, yes,
Mhm.
yes. And at the end, when your patient asked you, is it safe to go home? You should to tell her about the warning symptoms and signs, red
Mm-hmm.
flags,
Yeah.
because it is a safety point.
Yeah, I told her if you have any bleeding or pain or shoulder tip pain, you should call the contact number, right?
Okay.
Yeah.
All about this task. It is a famous task. It is a recall, and in every time there is a clinical and also a lay examiner. You should to know
Mm-hmm.
that the lay examiner is emotional, and
Mm-hmm.
they instruct the lay examiner. They told the lay examiners, please put yourself instead of the patient and tell us, is it okay to be treated like this?
Okay.
Okay, thank you, Dr. Malak. Do you want to ask
Welcome.
anything?
No, thank you.
Anyone
Thank you.
want to ask anything in this task?
Hello,
Hello?
sir. I'm Hina here. Sir, as you just said, that it is not good to say that if you have already said something in the task and the road player might have not got it, and he's asking the same question. Like as the doctor said that I told you before, I told that, and this is not a good thing. So what else we can say so that this is not give them the feedback that they were not listening and we have already told them.
Answer the question again. Because sometimes in some tasks, usually the urogyne or the oncology, the role player will be like an elderly patient, and she is instructed to repeat some question.
Okay.
So please re-answer the question again.
And don't say that I told you this thing before. Don't say that.
No, try to change some words, try to be more clear, or you may answer the question in a wrong way. So she want to prompt you. She want to tell you you are not answering well.
Okay.
So
Okay.
try to modify your answer.
Okay.
Usually, role players want to help you. Role player is not your enemy. Time your enemy, you your enemy, yourself, I mean, but role player is not your enemy. Okay?
Okay, okay sir.
Any other question?
Dr. Mekky, I have a question, please.
Okay.
Yeah, you said that like this is a case of emergency, right? And also in any other case scenarios, the mentors they focus that we should take a targeted or a focused history. Could you please tell what could be the possible focused or targeted questions in such scenarios like this one, so that it will help us save some time in information gathering, like especially the history when it goes beyond 3.5 or 4 minutes.
Okay. We will take this task as an example. Okay. After introduction, we will we will start our history taking by an opening question about the current complaint. The current complaint here is a light vaginal bleeding. So I can say, or I can ask here, please tell me more about the vaginal bleeding. So she will answer you by some sentences, and then you will analyze this complaint, analyze the answer of your patient. So you will ask it here, when this started, is it increasing? Is it proceeded by anything? Did this affect your daily activity? Is it associated with pain? If yes, where is the pain? how intensity of the pain. This is about the analysis of the complaint. And then the second question is the symptoms and signs of emergency. Like here, you from the scenario, you know that it may be an ectopic pregnancy. So you will ask here about any signs or symptoms of internal bleeding, like shoulder tip pain, like fainting, syncope. Is it right? Am I clear till now?
Yes, Dr. Baki, like that part is understandable that we ask about the current symptoms and then a little about any possible a serious condition like symptoms related to ectopic pregnancy. So, like, where could we miss questions in this kind of scenario? Like, especially when it comes to this, like, it must be mentioned somewhere that this is her first pregnancy, so we can skip the OBS history and then how much we should ask in the gynae history and in the general history pattern in regarding the medical and surgical and about her smoking and lifestyle and mental health. So that is what I want to know, that do we need to cover all that thing
No, no, no,
quickly?
no,
And
no, 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 no,
yeah, that's
no.
my
You
concern.
don't.
Yes, sir.
No, there is no a template for history taking. There is no a template for history taking. Act as you are in a real situation with your patient. If you have a patient with a pregnancy of unknown location in your clinic or in your hospital, will you ask here about the regularity of the menstrual cycle? Will about the support at home? You may ask here about support at home because of vaginal bleeding and domestic violence. It's okay, but I think psychological here is irrelevant. Family history here is irrelevant. Relevant history, relevant question, which its answer directly affect your management plan, directly affect your discussion with your patient. This is the relevant question. This is a relevant history. Am I clear? So try to be logic. Try to be logical in history taking. I have a patient with light vaginal bleeding. I know that the patient a pregnancy of unknown location, so I will try to exclude ectopic pregnancy and exclude signs and symptoms of emergency right now. And I will ask her about her wishes about this pregnancy. This is the relevant question. This is relevant history taking. Try to finish the history taking in just 3 minutes. And at management, if you want to prescribe to your patient any drug, any antibiotics, ask here in management, do you have any allergy of any drug? No. So we will offer you blah, blah, blah. If you want to offer your patient a methotrexate, for an example, ask her before that, do you have any problem with your kidney or your liver? But try to finish history taking in 3 minutes. This will make you feel like you are the leader here. And the stress will be decreased. But when you finish a lot of time in history taking and your brain have a lot of information you want to discuss with your patient about the management, you will be very stressed and you will not give your patient time for communication. Okay? Am I clear?
Yes, Dr. Maki, that's helpful. So, like in this scenario, apart from the current questions like related to her and a pregnancy of unknown location and the possibility of ectopic pregnancy, those questions are important. And maybe about drug allergies, as you mentioned, we could ask in the history or in the management plan. that and any a little bit about the surgery and medical. Otherwise, nothing like the
No,
family
no, no.
history.
No, I think risk factors. You should to ask about risk factors, like
Hmm.
Dr. Malik asked, like sexually transmitted disease, like surgery, previous surgery in abdomen, because the risk
Yes.
factors, that if I asked the patient about any risk factors for ectopic pregnancy in an pregnancy of unknown location case, if she told me that there is no risk factor, so I will be okay when I told my patient, it is safe to go home. But if I have a risk factor, like yes, I have a surgery before, yes, I have an ectopic pregnancy before, yes, I have sexual transmitted disease before, so I have a risk factor to be ectopic pregnancy. I will tell her about the warning symptoms and signs and the red flags, and I will be more careful about her case. So in this case, I think the risk factor is very important. Also, you should to know that in history taking, we have sometimes we have a differential diagnosis. So in history taking, I may ask about a question that may lead me for a diagnosis. You should not follow fixed template. Okay, you will go for every case. It is a case like any case in my clinic, like any case in my hospital. I will ask here a logical history. Is it okay? Any question?
No, thank you so much, Dr. Maki, for clearing that.
Okay, we have the second task. Who will do? Hello. Mm-hmm. Ina.
Sir, I have not seen this task before. As you're saying, it would be a recall, but if you say I can attempt it, I can take a chance. But otherwise, I have not seen this before.
Okay, so anyone else? Shireen, iPhone, anyone? Amara. It is a very easy task.
Mm.
Mm-hmm.
Can I try?
Yes. Okay, Hina, you have 2 minutes for reading, and then we can start. Okay, shall we start?
Okay, sir.
Okay, you can start.
Hello, I'm Dr. Henna, one of the doctors on duty. Am I talking to Mary Smith?
Yes, doctor.
How may I address you?
Here is okay, doctor.
Okay. So, Mary, I can see that you heard that your midwife sent me to you that you're concerned about your HIV testing. Is that so?
Yes, doctor. It's okay.
So, okay. Mary, tell me any other expectations for today's conversation?
No.
Okay. So, Mary, before addressing your concerns, I want to take more information regarding you, and then we can make a shared plan. And at the end, I'm going to give you a patient information leaflet. And if you want, I'm going to book an appointment with my consultant. How does it sound to you?
It's okay, doctor.
Okay. So, tell me Mary, tell me more about your pregnancy.
This is my second pregnancy. Everything was okay, and I'm here for the screening test.
Okay. And is everything all right so far? Any complaint of nausea, vomiting, bleeding?
No, everything was okay.
Are you taking folic acid, Mary?
Yes, started folic acid.
Okay, good. Is it your planned or unplanned pregnancy?
It is planned.
Good to hear that. And tell me more about what was your history about the previous pregnancy?
Everything was okay with the previous pregnancy.
Okay, and what was the outcome?
What was what?
What was the outcome?
My son John,
Okay, okay. How old is the John now?
3 years.
Okay, good, good. So, any history of, pardon me for asking, any history of sexually shared infections in the past?
No.
Okay. And I want to ask some personal questions, might be intrusive, but important to know. And are you in a stable relationship?
Yes, I am in a stable relationship with my new partner.
Okay. And okay, can you please tell me more for how long you people are together?
Just 1 year.
Okay, okay, okay. And any histories of medical history of consult for which you have to visit your GP?
No,
Okay. Any surgeries in the past?
no.
Okay. Do you smoke, Mary?
Yes, sometimes.
Okay. And do you take alcohol?
No,
Pardon me for asking recreational drugs.
no.
Okay. And do you feel supportive and safe at home with your partner?
Yes.
Okay. Mary, can you tell me, please, what do you do for a living?
I am a waiter in a restaurant.
Okay. Okay. So tell me more, Mary. Thank you for being open to me. And tell me more what are your concerns regarding your screening test?
No, I don't have any concern. I don't want to do the HIV screening.
Yeah, yeah. I can see that. Why you don't want to go for that screening? Any special concerns? Any ideas for that?
Doctor, I do it in my last pregnancy and in the previous pregnancy, and everything was okay. So why I do this again? I don't want to do this screening test.
I acknowledge your concern, and I am happy that I'm glad that it was you're all right. Your all the results were all right in the last pregnancy. So, Mary, I want to tell you that we have these screening tests. These are the baseline screening tests along with the other virus serology markers. We do it for the every pregnant patient at the booking to see their baseline health profile along with the virus serology, because if we find any infection in the patient, that would be very important for the management of the further pregnancy for the lady as well as for the baby. Are you with me, Mary?
Yes, doctor. But so if you found that I have this HIV, what's that mean for me and my baby?
I understand that you're very concerned about that. If we found HIV in the test, unfortunately, then we would be having a treatment plan. We would be referred to you gum clinic for the screening of other infections, and also as well we are going to involve the our consultant in the plan along with the infectious specialist consultant to see how we can reduce the transmission of this virus to your baby as well as transmission in your body. And it always depends upon the viral load on your body, and also at which stage you got the infection before. If you we pick the infection either before the 28 weeks or after 28 weeks. And am I clear here so far, Mary?
Yes, doctor, you are clear.
And if we find the infection in your blood, this virus in your blood, we are going to give you certain medications in the form of like xylobutine and other medications that would be baby friendly medication would be offered to you. And these medication would be reducing the risk of transmission from the this virus to the baby. And
Mhm.
also at the time of delivery, our aim is to keep the viral load less than 400. If this viral load is 400 and beyond, and if this viral load is less than 400, we would be taking you till the term, and we would be offering you the mode of delivery as you wish for. And sorry, I forgot to ask how the John was delivered. Was it with the normal vaginal delivery or was it cesarean section?
No normal delivery, doctor.
Okay, okay. Thanks for telling me. So, if the viral load is low, we can treat you as a normal patient. We can offer you a normal delivery. And if the viral load is high, then the more than 1,000, then it would be benefit for with this pregnancy, we won't be very much comfortable to go with the normal delivery, and we would offer you cesarean section. And also, after the delivery, your baby would be cared by the neonatologist and would be checked for the further testing for virus in the blood. And also, the breastfeeding. I also want to tell you that breastfeeding also carries some risk of transmission from mother to baby. So,
Doctor,
sorry, yeah, Mary, you continue, please.
doctor, I am a waiter in a restaurant, and I am afraid if I got this HIV and the screening was positive for HIV, that you will told my employee and employer, and he will fire me.
I'm so sorry that you are very concerned about that, but let me tell you that this is a sexually shared infection and also with the certain risk of transmission through blood products. This is not something that transmits through droplets infection. So it is not like contaminated, not going to contaminate others, but or spread infection to others. But if you're we all are here to support you. You are so stressed out. I can connect you to the support services also. Am I clear to so far, Mary?
So you will told my employer?
No, no, I am not going to tell you. Your data would be confidential, and I address your concerns. And I can tell you, Mary, that nothing of your information would be shared to anyone without your permission, and your confidentiality would be maintained. But for your safety and for other safety, if you are close to someone, then it is good that you share that you have this infection, and you can tell to your near ones about this, and they may be more caring about you.
Okay, doctor. So, what we will do right now? If I don't want to do this screening, will this affect my antenatal care plan?
You would be booked for the antenatal care plan as per routine, and but certain HIV, as HIV screening is must, because that if it is not done, we might not be sure that the patient is carrying this infection or not, and all the healthcare staff and others would be at risk. So it is better to that you can go for the screening. I would like to give you a patient information leaflet. You can read upon it and make up your mind, and can I can give you appointment with my consultant so that you can have more discussion about that.
Okay, thank you.
Thank you.
Perfect. Perfect. Thank you for participation with me. We have just some modification,
Sorry, I've never seen this task. I just tried to do as I can do for the cook-up of mine. Even I don't know the right now the exact HIV drugs to be given in the pregnancy or not.
but you do it perfectly in a perfect way. I think, I usually love the new tasks. I usually love to do a new task, even in the exam, because, the recalls and the known task for us. We have a lot of information. We know about this task. We want to tell the examiner about all the information, all the knowledge we have. And usually the tasks not didn't want this huge amount of knowledge which we have. So I usually love the unknown tasks. You did it perfectly, but I have some modification. Please don't ask in at the beginning of your discussion with your patient any expectation, any concern, anything you want else you want to discuss in this task or in this case or in this. No, don't start with this
Okay, okay.
because this is not logical. Uh, I have a patient, and when I started to um, started the discussion with my patient, I asked her, "What's your expectation of this?" I think it isn't a logical question. So try not to start with your discussion with your patient about her expectation.
Okay.
Don't ask more than one question in one sentence. You asked her, "Do you have any nausea, vomiting, bleeding, pain?" If you want to ask a closed question, just ask one question. Do you have nausea? She will told you no. Vomiting? No. Any pain? No. Like this.
Mhm.
Okay. About
Okay.
sign posting before sexual history, it was very important. You have some irrelevant question like for how long you are with your partner. I don't know why you asked about this. You asked here also about
Well, well,
if he is supportive or no. Also, I don't know why you asked this question, because when you asked here about stable relationship,
so I
so
asked this because this is HIV, so patient might be having multiple sexual partners, and she wants to hide some information, and she doesn't want to go for a screening test.
okay, but you asked here about stable relationship, and then you asked here about support. I think this is the same question. Also, in tasks like these tasks, please ask directly about why you refuse the screening for HIV.
Okay.
The first question, can I know why? This is a complaint right now. Can I know why you didn't want to do the screening for HIV?
Okay.
She will told you about I have do it. I don't have to take blood from you. Took a lot of blood for other tests. But the main cause, she was afraid from if you will told or the NHS will told her employer. Okay,
Sorry, sir. I
about
I didn't get this. Can you please repeat that?
you may ask your patient directly at the beginning of history taking, can I know why you didn't want to do the screening for HIV? She
Okay.
will told you a wrong answer. And then after you will told her about the effect of HIV on her on and her baby, he will told you about the main cause.
Okay.
Okay, about the smoking dialogue. When you ask any patient in any task and he told you, yes, I am a smoker, tell him about or tell her about the smoking dialogue. You know, smoking is may affect your body. So, did you want from me to offer you a referral for the NHS smoking cessation service? Yes, doctor,
Oh,
it's okay.
oh,
So I will offer you. Okay. You after that in the discussion, you were perfect. You give her the confidentiality, give her time to express feelings. I think your communication was very good. Thank you.
thank you. Thank you.
Okay, anyone want to ask anything
Sir,
in this task?
can you please tell me how many minutes I took it for I took for this task?
You took about 10 minutes and you took 4 minutes for history taking.
Okay. Thank you.
Thank you. Anyone who want to ask anything in this task?
So the agenda behind the task is that patient was hiding the information, and she did not want to, and she doesn't want the any sort of result to be told to her, at the workplace.
No, patient afraid from the NHS or the doctor to tell her employer about her HIV because she have an idea that HIV can transmitted by serving food.
Okay, 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 okay.
So your role here to tell her that HIV is a sexual transmitted infection and it is not transmitted by serving food. So we will not tell anyone except the medical personnel who will direct manage you and your partner.
Okay,
Okay.
okay, okay.
Okay. We have a very
So,
important task here.
should I also tell her the condoms in the sex condom use for the if she gets if she gets HIV positive result?
If she got HIV positive, we will tell her about the management of HIV, but now we will not discuss about the management.
Okay.
Now we want to tell her that HIV will not be transmitted by serving food. Tell her about the importance of the screening. What is the importance of the screening? This is the effect of HIV. If if you if you about the patient, if you have HIV, it will affect you and your patient. Blah blah blah. So it is very important to do the screening. Okay.
Okay.
Okay, who will do this task? It's a very important task, and also it is a recall, one of the difficult tasks. Hello? Usha, you want to do the task?
Yes, sir, I can
Patient?
try.
Okay, perfect. You have 2 minutes for reading.
Okay.
Okay, shall we start?
Yes, sir. Okay. Uh, Hello, I'm Usha, one of the exam candidate, and I'm ready for discussion.
Hello, doctor. Please give me a short summary about your case.
So, my patient is primary gravida presented with pain in abdomen, flank pain, and also body ache. On background, she's a 30-year and she's on aspirin and Afro-Caribbean. So, uh, and also so on I will manage this case taking a history and assessment and then my recommendation on base of the assessment.
Okay, so what's your differential diagnosis?
So my differential diagnosis as blood pressure was given 160 y 100. So and also protein in urine. So my first diagnosis is preeclampsia and also the view of she is a Afro-Caribbean and also she had a blood transfusion. So the second crisis it could be the sickle cell crisis and also the she is having a chest pain and also preterm labor and the UTI could be the and also because she is taking aspirin and also she is a 34 week, so it could be and also Afro-Caribbean could be the what we call it is peripartum cardiac patient.
Okay, so what is the history you need in this case?
So I will ask history of detail about her pain. Since how long she started on pain, severity of pain, and the site of pain, and anything make it worse, and any relieving factor or aggravating factor. And also, I will score on 0 to 10. So, and then I will ask about. Whether this pain is continuously or intermittent pain and then I will ask about the regard the pregnancy detail and also I will ask about whether this pain is the first episode or recurrent, whether she had a before as the same pain in pregnancy or before pregnancy as well, whether this pain associated with any fever, chills and rigor or rashes and also then I will ask about any leaking, any discharge and any bleeding and fetal the baby's the fetal movement, any change in, or then I will ask about the pregnancy detail, whether this planned pregnancy or unplanned pregnancy, whether she attended all the antenatal booking, blood and antenatal blood test and ultrasound, and also any other medical comorbidity like hypertension, diabetes, asthma, or any sickle cell disease, and these the medical disorder, any surgery previous on abdomen, or any allergy, and also family support I need to ask. And also I will yeah, ask about any family history of a cardiac disease, and any thrombophilia or any cardiac disease, any high blood pressure and diabetes. And also I will ask about her social history, smoking, alcohol, recreational drug, and then BMI, and BMI, blood group, reservation for blood transfusion to rule out Jehovah Witness, support at home, and also make sure rule out domestic violence as well. And what is her occupation, and then a mental health issue, anything in the current or in the past. So these information I will check. And any regarding she I can see she had a blood transfusion, so I will ask about detail about this, why she had, when she had, and where. Mm.
So what's your management plan?
So management plan, will examine her in presence of chaperone with her consent, to the check the general physical examination, and check the BMI and also vitals. I can see blood pressure is higher side. So this is and I will send yeah, arrange ultrasound for the after examining her, yeah, the abdominal examination for pain, whether intermittent or the contraction or abruptio. So I will rule out this abruptio as well. And then per vaginal, if she is complaining of any leaking, bleeding, or then we'll do per speculum. Will not do per vaginal. And then arrange ultrasound to fetal weight and location of placenta and amniotic fluid. After that, management and send the blood test for hemoglobin as well. And also, yes, so here is the blood test was given. This is the most likely sickle cell crisis, and also blood pressure is high, so it's preeclampsia as well. So we will start for admission in high dependency unit, and management will be involving MDT, my consultant, anesthetist, and neonatologist, specialist midwife, and and nurse. And I will explain her. She need admission now, right now, to come the blood pressure medicine. So labetalol is the first line of treatment. It start from the IV in the oral, and if it is not relieving, she is not, and also painkiller. So put IV line, the fluid, and give pain relief, and also labetalol, and monitoring every 15 minutes till blood pressure come down, and then every hour. So
Okay. And when you are going to deliver this case?
yeah, because she's 34 week. If so, after managing, if her blood pressure and pain control, and then they will the further management. We will high risk pregnancy. So at the booking in a consultant unit if she was not booked before, and further every if her symptom resolve, then we can I mean we can conserve till 37 week. and depending on the whether she is a sickle cell, because I can see the HVSSV sickle cell, so we will delivery after 38 week.
Okay. Do you want to add anything?
Yeah, so I will explain her. She will have a delivery in the hospital where all the facilities available, and normal delivery. She can choose normal delivery or cesarean section if further no deterioration for fetus and babies and mother. And then during intrapartum, she will we will if it is a sickle cell disease, then painless we will give IV fluid during labor to minimize the hydration, and also pain relief. To the pain is the risk, the trigger factor for crisis, and also continuous fetal monitoring, and neonatologist will be informed at the time of labor start, and continuous monitoring for mother and baby after delivery. Baby will be checked by baby doctor, and we will active management of third stage of labor. And then she will encourage for breastfeeding and discuss the contraception, and when she is able to eat and drink, and early mobilization in postnatal period, we will discharge her with the red flag sign.
Okay, thank
Thank
you.
you for it.
Thank you,
So
doctor.
thank you, sir.
Okay. You have the knowledge, but we want some modification. In any
Hmm.
case, in any
Yes, sir.
structured discussion case,
Hmm.
you should to start by a SPAR tool. You should to give a summary
Hmm.
about your patient, and you starting with a SPAR tool. We will not say to the examiner we will use the SPAR tool, and also we will
Hmm.
not say the situation is, the background is. No,
Hmm.
you will give him this the SPAR tool like what I said. What I will say right now. I have a case of acute chest pain. She
Hmm.
is prime gravita 34 weeks. So the situation here is the acute chest pain. The situation is the most distressing information in the scenario.
Hmm.
I will not call my consultant, or I will not discuss with my colleague about a patient, and I will, I have a patient 30 years old, 34 weeks, prime gravida, have an acute chest pain. You look like a lax. There is a laxity.
Hmm.
No, I have an
Hmm.
emergency here. So I have a
Yeah, this
case of
is emergency. Yeah.
acute, acute chest pain. He's 30 years old, 34 weeks, prime gravida. And then I
Hmm.
will go for the assessment.
Hmm.
After that, what is the differential diagnosis? In every case of differential diagnosis, even in written exams, you should to justify your differential diagnosis. Why I think about this diagnosis, not just enumeration.
Hmm.
So, what's your differential diagnosis? The patient have an acute chest pain. So I have a differential diagnosis of acute MI.
Hmm. Acute trauma. Yes. Yes.
Also, it may be sickle cell crisis, acute chest syndrome, because the patient is a sickle cell diseased patient.
Hmm.
Also, it may be pulmonary embolism.
Yes, sir. Pulmonary
Also,
yes.
because the patient is a sickle cell diseased.
Hmm.
Also, it may be a pulmonary edema because of the high blood pressure. Am I clear?
Yes, sir. Yes, sir.
It may be a chest infection because of the high temperature.
Yes, sir. Sepsis.
And after after this, after I told my examiner about my thoughts about the differential diagnosis, I will focus on the most logical diagnosis. For me, in this case, I think it is a case of acute chest syndrome
Hmm.
or a sickle cell crisis, acute chest syndrome, precipitated by UTI because the patient urine have a high nitrite and pus cells in urine,
Hmm.
complicated by preeclampsia.
Yes, sir. Complicated. Yes, sir.
So the sickle cell disease have a UTI, so the UTI exacerbate the crisis and do acute chest syndrome, and the sickle cell disease itself complicated by preeclampsia because of high temperature and protein in urine.
Hmm. Yes, sir.
This is about the differential diagnosis. So I go through that all my thoughts about the differential diagnosis. I told my examiner why I think like this, and then I told him about the most logical diagnosis for me. How I
Yes.
can prove this diagnosis? By going through history. So I will take history. So what is your history? In every case, in a structured discussion, don't tell your examiner about anything without justification. So I will ask
Okay.
her, I will ask her about the analysis of pain,
Yes.
like the exact site of the pain, because pulmonary edema, it may be all over the chest.
Hmm.
Acute
Yes, sir.
MI, it may be central, radiated to the left shoulder.
Yes, sir.
And then what else you may ask in history taking? I will ask
Yeah.
her about flank pain
Flank pain, UTI. Yes.
because of UTI.
Yes.
I will ask her about if she took any painkillers.
Yes. Yes.
Okay. I will ask her about hemoptysis because pulmonary embolism
Pulmonary
and
embolism.
pulmonary
Yes.
edema may cause hemoptysis. I will
Hemoptysis.
ask her
Yes.
about dyspnea,
Yes.
orthopnea,
For P.
anything I will ask or I will tell my examiner about, I will tell him why I asked this question. You should to
Okay.
justify your answer. After that,
Yes,
about the
sir.
management plan, I will manage about this case according to the differential diagnosis and according to the most logical diagnosis, which is acute chest syndrome and preeclampsia. It is a case for
Yes.
of admission, so I should to admit this patient,
Yes,
and
sir.
I must control her pain after exclusion of any other cause
Yeah.
of chest pain, like by doing echo, by doing ECG.
Yes, sir. I see. Yes.
Am I clear?
Yes, sir. Yes, sir. I.
And when are you going to deliver this case?
Mm,
Will you deliver your case now?
so this is after stabilizing. We can if this is a sickle cell, then we can conserve till 38 week or
But if it is a case of eclampsia, if it is a case of preeclampsia, and it may be go to be severe preeclampsia or to be
then
eclampsia,
yeah
then
then
you
we can
can.
the after yeah then we can after stabilizing mother and then we can induce or cesarean section depending on the cervical stresses.
Yes. This is about how we can manage an SD task because it is very important.
Yes, sir.
When you justify your answer, you for the examiner you are a perfect one, and he won't he will help you. If you didn't say anything in the answer key, he will ask you directly about it. So
Hmm.
try to impress your examiner in the SD and also in the simulated patient tasks.
Yes, sir.
Thank you.
Thank you, sir, giving me opportunity. This is knowing thing and presenting in 10 minutes. That is very difficult. It's different.
No, you spend just 10 minutes, but if you manage your task like I said, I think
Yes.
you will I think you will finish this task in just 7 to 8
Five. Yeah.
minutes.
Yes, sir. Yes, sir. 5 6 minutes.
Okay. Because when I asked you about the history, you told me about all the templates of history without any
Hmm.
justification. So it is irrelevant and it is boring for the examiner.
Boring for examiner. Yes, sir. Yes, sir. You are right. Yes.
Okay, anyone want to ask anything?
But one question, sir, I just want because if I miss, suppose Jehovah Witness, if I miss that, they will say this is the patient safety. If uh, if I miss the smoking alcohol and she is smoking, so then it is a patient safety like that. So that's
Doctor,
why.
not every doctor, not
Hmm,
every not every Jehovah Witness or not every alcohol or smoking is a safety point in every case. It may be a
yeah.
safety point in a case of postpartum hemorrhage. So I have a postpartum hemorrhage and I will give her blood products. So it is a safety point to ask about if
Hmm,
she will accept these products or not.
hmm, hmm. Okay.
But
And
here,
suppose.
how not in all
Okay,
cases.
sir.
Why I will
Not
ask
in
in
all
antenatal
cases.
care about HIV about Jehovah Witness? Why about acceptance of blood? Why antenatal care, early pregnancy without any complication?
So we should not ask. Okay.
Try to be
Hmm.
real. Try to be logical.
Yes.
Okay. Anyone want to ask anything?
Okay, one more, sir. I suppose, like you said, okay, we are not giving blood to everyone. Okay, BMI, this will affect management, or like in antenatal cases. So we should not ask about BMI or mental health.
No. If BMI will affect your management, ask about it. If it is not
Hmm.
given in the data, in the scenario, anything will affect your management, ask about it.
Okay.
Okay.
Hmm.
I'm very happy
Thank
to
you,
be
sir.
with you today, and I
And
promise I will do it again. I want
thank you.
more participation. I want more question. Join us at our WhatsApp and Telegram groups. You
So
will
which one is your Telegram group?
yes.
Oh,
What?
okay, this one.
Yes, this is a Telegram group and this is a WhatsApp group. Please join us and thank you.
Thank you, sir.
Bye bye.
Thank you.
Thank you.